So I think it was a very, very valuable exercise, and actually the feedback from the people in the room would reiterate that. I think the commonality of people said was that what they don't have is a forum to actually go and talk about these things. Now, we did this on the basis of we wanted to talk about the positives in IT, not the negatives in IT, and it was interesting having the journalists in the room, most of whom have written negative stories about IT, as it's certainly healthcare IT. But the general consensus of opinion is we all do lots and lots and lots of good things, and certainly from Simpl's point of view, then that's what we see. A vast experience in working with the NHS and with the private sector too, private health sector too, is that they do lots and lots of good things and they do them very, very well. They just don't talk about them very much. And having that forum where we can all sit down and actually share those informations, I think, was valuable not just from us for facilitating it, but actually for the members of the NHS and for the private health folks there too, because it gave them a forum to share their ideas and to say what's working well and what's not working well. I think a good example was the two Birmingham trusts, who are literally next door to each other, and they were sharing information between themselves at a forum in London, and that's just a good example of the opportunity to talk about these things in the NHS.
I think it's got enormous value, especially as we had a few clinicians and a lot of IT specialists of very varied backgrounds. Some of them really came from the business change, business process re-engineering angle. Some of them came more from the traditional IT aspect. I think it's immensely valuable because at the end of the day, if these communities can't talk effectively together, then IT can't make the contribution that it needs to make to better patient care.
To be honest, I think it's actually been a personally very interesting day. Yes, I have been to round table events before, but typically they tend to be aligned to professional forums that I belong to, such as the British Computer Society, the IT Service Management Forum, etc. And I think in some respects they tend to be very core focused on what is ICT about, what it's delivering, where its future is going, how will it deliver services, and what does technology look like in the future. I think what was interesting about this forum is that clearly it had a focus around health, irrespective of whether that came from a public or private sector. It was about, what are on people's agendas within that arena. And it was nice to actually hear there was a lot of common ground. It was also nice for once, I have to say, to actually hear people talking about the innovation and some of the stumbling blocks for them delivering that innovation and how they're trying to tackle those.
I think it's fairly rare. I've in healthcare in general, I've been to only one or two similar events in the past, and they've all been helpful. I've not heard of a similar event in healthcare IT. A snapshot of a broad amount of the debate around healthcare IT at the moment, I suppose, which is exactly what journalists needs to hear, and I mean also elements of the background and thinking about the future, but particularly a snapshot of what people are thinking at the moment and the issues there.
Well, I think the motion was carried. There is lots of innovation in IT going on in the NHS, and there's a will to innovate and experiment, and that can do the NHS nothing but good. And this doesn't in any way disparage the idea that we need to do some things on the national scale. So this is not, I think, in any way demolishing much of the work of the national programme. This is a huge add-on to it, which could actually help it do its job better and turn the things it does, which are really infrastructure elements, they're the things it does best, into, with additional innovation, applications and work by the NHS, can turn them into things which really do significantly make the NHS more efficient and provide better patient care.
I think to an extent there's an element of satisfaction, and what I mean by that is that across the cohort of individuals who were there, we've all got very similar issues. None of us have particularly doing anything what I describe as left the field that would alarm us in any respect. I think it was all reassuring, for want of a better respect. And I think for me as well is that I recognise, I think across the cohort of people there, we all recognise that, wouldn't it be nice to see if we could encourage innovation and creativity? Wouldn't it be nice if we could look at all of those processes that drive organisations to which we know that we can deliver some value to benefit those organisations? But also, interestingly enough for me, having the consultants and the clinicians there is still emphasising to me that there are some difficulties in terms of how organisations, ICT shops, try and communicate with their respective peers within the organisation. And I think for me that was quite an interesting one. We've still got some way to go to address that, I think. Right. Yeah.
I was actually delighted that we didn't have any dropouts. Normally when you run these things you expect a loss of somebody in some shape or form. or natural disaster happens, like tube strikes and all those sorts of things. So, but today it all went remarkably smoothly. I thought the venue was good when we all got there, and the setup was all very informal. It was nice, it was relaxing. It was good to have the ability to have coffee and then sit down at the same table. We weren't shuffling between rooms. The fact that we got such a good blend of people there is really down to the organisation and the logistics that you and Toby did, Gavin and Toby did. So we've got, I think, a well-organised event, which I think they've got a lot of benefit from. We've re-established some existing contacts, and we've made some good contacts for the future. So at the moment, I'm delighted with it.